When a person gets stung by a bee, the experience often begins with a sharp, sudden pain, like a tiny pinprick on the skin. This pain is caused by the bee's stinger piercing the skin and injecting venom. The stinger is a tiny needle-like structure connected to the bee's venom sac, and when it punctures the skin, it releases a complex mixture of chemicals designed to protect the bee and its hive. These chemicals include proteins and peptides that affect the skin and nervous system, triggering an immediate response from the body. Almost instantly, the affected area may become red and swollen. This is the body's first line of defense. The immune system recognizes the foreign proteins in the venom as harmful, activating specialized cells to respond. Mast cells in the skin release histamine, a chemical messenger that increases blood flow and allows immune cells to reach the site quickly. This is why the area around the sting begins to swell, turn red, and feel warm. The swelling is a natural defense mechanism, but it also causes the characteristic bump that most people associate with a bee sting. For most people, the pain and swelling are mild and temporary. The pain usually peaks within a few minutes, while the redness and swelling can last for several hours to a couple of days. Over-the-counter remedies, such as antihistamines or topical creams, can help reduce itching and swelling. Applying ice to the sting site can also constrict blood vessels, slowing the spread of venom and reducing discomfort. However, not everyone reacts the same way to a bee sting. Some individuals experience more severe reactions. In cases of mild allergic reactions, symptoms might include larger areas of swelling, itching, or hives that appear near the sting site or even on other parts of the body. These reactions are uncomfortable but generally not life-threatening. The body's immune system is simply reacting more strongly to the venom than usual, releasing extra histamine and other chemicals that amplify the inflammatory response. In contrast, individuals with severe allergies to bee venom may experience a life-threatening reaction known as anaphylaxis. Anaphylaxis can occur within minutes of the sting and can progress rapidly. Early signs include difficulty breathing, swelling of the lips, tongue, or throat, rapid heartbeat, dizziness, and a drop in blood pressure. The immune system in these cases overreacts, releasing large amounts of histamine and other chemicals into the bloodstream, which can cause shock. Anaphylaxis is a medical emergency, and immediate treatment with an epinephrine injection is required to prevent fatal outcomes. Even in people without severe allergies, multiple bee stings can pose serious risks. Bee venom contains compounds that affect the cardiovascular and nervous systems, and a high enough dose can overwhelm the body. Symptoms in these cases may include nausea, vomiting, headache, confusion, and even seizures. Medical attention is advised for multiple stings, particularly in children, elderly individuals, or those with pre-existing medical conditions. Interestingly, the pain from a bee sting is not caused solely by the physical puncture, but also by the chemical components of the venom. Melittin, one of the primary compounds in bee venom, directly attacks cell membranes, causing cell damage and triggering pain receptors. Phospholipase A2, another enzyme in the venom, breaks down cell membranes and increases inflammation. Other substances in the venom, such as hyaluronidase, allow the venom to spread through the tissues more easily, enhancing its effect. The combination of these chemicals explains why a bee sting can feel disproportionately painful compared to the tiny size of the stinger. After the initial sting, the body begins a healing process. Immune cells clear out damaged cells and venom particles, while the skin regenerates. The redness and swelling gradually subside, and the pain diminishes. Most bee stings heal without complications within a few days, leaving only a small, temporary mark. In some cases, scratching the area can introduce bacteria and lead to secondary infection, which may require medical treatment. Proper care, such as cleaning the site with soap and water and avoiding scratching, helps prevent such infections. For those prone to severe reactions, preventive measures are critical. Wearing protective clothing when around bees, avoiding areas where bees are actively foraging, and carrying an epinephrine autoinjector can save lives. Some individuals may also undergo venom immunotherapy, a process in which small, controlled amounts of bee venom are administered over time to desensitize the immune system. This therapy can dramatically reduce the risk of severe allergic reactions in the future. Interestingly, humans have coexisted with bees for thousands of years. Bees play a vital role in pollination, and their stings are usually defensive rather than aggressive. Most bee stings occur when a bee feels threatened or trapped, such as when someone accidentally steps on a hive or swats at a bee. Understanding bee behavior and maintaining a calm demeanor around bees can greatly reduce the likelihood of getting stung. In rare cases, a bee sting can trigger delayed reactions. These reactions occur hours or even days after the sting and may involve prolonged swelling, fever, joint pain, or other systemic symptoms. While uncommon, delayed reactions indicate that the immune system continues to process the venom and respond even after the initial pain and swelling have subsided. Medical consultation is recommended if any unusual symptoms develop after a bee sting. In summary, when a person gets a bee sting, the body reacts in a series of complex steps. The immediate sharp pain and swelling are caused by the injection of venom and the activation of the immune system. For most people, these symptoms are mild and temporary, while others may experience severe allergic reactions requiring urgent medical attention. The venom's chemical components, including melittin and phospholipase, cause pain and tissue inflammation, while histamine and other immune mediators produce redness and swelling. Healing typically occurs within a few days, but preventive measures, awareness, and proper care are essential to avoid complications. Bee stings are a reminder of the delicate balance between humans and nature. While bees are essential to life on Earth, respecting their space and understanding the body's response to their defense mechanisms is crucial for our safety.